The pentose phosphate pathway is going to have two important functions. The first function is going to be to produce NADPH. The other important function is going to be to produce ribose 5-phosphate. Ribose 5-phosphate can be used to synthesize nucleotides, which are important in our DNA, and NADPH is going to have three really important functions. The first important function is going to be to synthesize fats, steroids, and cholesterol. The second important function is going to be to protect our red blood cells. And the third important function is going to be to strengthen our immune system. Now, normally glucose goes through glycolysis to produce pyruvate. But once it reaches glucose 6 phosphate, as well as fructose 6 phosphate, it can actually shunt. It can shunt through the glucose 6 phosphate dehydrogenase enzyme to produce 6 phosphogluconate and then ribulose 5 phosphate. And when it does that, it is going to generate NADPH, which is really important. And one important thing to keep in mind is that patients who have glucose 6 phosphate dehydrogenase deficiency are going to be at a higher risk for immune disorders. They're going to be at a higher risk for anemia, as well as other things that we talked about, like fatty acid synthesis. Now, fructose 6 phosphate can be used to generate ribose 5 phosphate through the enzyme transketolase, and vitamin B1 is an important cofactor for this reaction. Now let's go over what would happen with glucose 6-phosphate dehydrogenase deficiency. Now, as we said earlier, NADPH is really important for fatty acid synthesis, and we can see NADPH being used to convert malonyl-CoA to fatty acid. So if we have a deficiency in glucose 6-phosphate dehydrogenase, then we'll have low levels of NADPH, and we won't be able to go through this step as normally, and so we will have a problem synthesizing fatty acids. In this slide, we're going to go over how NADPH is going to be used to protect our red blood cells. Now, normally with oxidative damage, we're going to have this buildup of hydrogen peroxide. Hydrogen peroxide is going to be very damage causing to our cells. So as a result, we need to stabilize this compound. And the way our body does this is by using glutathione. Glutathione is going to convert hydrogen peroxide into water to stabilize it. And we're going to regenerate glutathione with NADPH. So once we use up glutathione to stabilize hydrogen peroxide, glutathione is going to be converted into glutathione disulfide. And to regenerate glutathione, we need NADPH. So if there's a patient with glucose 6-phosphate dehydrogenase deficiency, because we have low levels of NADPH, we're not going to be able to regenerate glutathione, so we'll have low levels of glutathione, and as a result, we'll have high levels of hydrogen peroxide. So this is going to then cause damage to our red blood cells, which can lyse our red blood cells and cause anemia. And this is why patients with glucose 6-phosphate dehydrogenase deficiency are at a higher risk of developing anemia. Now let's go over how NADPH is going to be used to protect our immune system. Now normally phagocytic cells are going to use NADPH to produce hydrogen peroxide and bleach, and these are going to be compounds used to kill bacteria. Now, if we have low levels of NADPH again, then what's going to happen is we're not going to be able to produce these compounds, and as a result, patients are going to be at a higher risk of infections.